Are you able to turn your camera on, or are you not
Oh,
able to?
why isn't it on?
I assume that was your preference.
Oh,
So
no,
I'm
no,
glad
no.
I asked. Should do something different to your hair. It looks nice.
Yeah, it's called washing.
I should try it.
You never know.
Yeah, could work for me.
Yeah. Do you have a wife who tells you to take a shower?
I have a girlfriend, so she's probably soon she will start becoming more prescriptive.
Exactly.
Yeah.
Hang in there. You'll see.
Yeah. Well, how are you?
I am good. It's a pretty day. The air conditioner's working. My granddaughter's playing downstairs with my wife.
Oh, I'm sorry to take you from that. How old is she?
Just turned 2.
Awesome.
She still likes to jump up and hug Campa.
Oh yeah. You'll probably miss the day that she calls you that.
Oh, for sure.
Yeah. So I was looking back at our last conversation. Obviously, the one that we had on over the phone wasn't recorded.
No.
But it's probably worth rewinding back to where we left off.
Yeah.
And I found that some of what we talked about on the phone was would probably be worth revisiting. So
okay.
When I look back at our first conversation, we left off right at the edge of you describing operant conditioning as it relates to neurofeedback, and specifically this sort of unconscious operant conditioning.
So the mechanism that we are basically taking advantage of in this approach is called the orienting reflex. And it's that reflex that when you're sitting on the beach and the seagull flies by, you automatically start tracking the seagull. There's a built-in neurological mechanism for that that's always orienting us to whatever's moving in our field of vision, which goes back to, when we heard the twig crack in the forest, we then started looking for whether there was something going to come out of the bushes to eat us.
Or that we could eat.
Yeah, generally speaking, it was the other way around.
Okay.
But like if we didn't see what we were after, and we heard a twig crack, then we're either tracking something we want to hunt or something we want to run away from.
The orienting reflex, I guess the premise is that you can manipulate that, though it be automatic.
So you can stimulate the orienting reflex by, in our case, changing the brightness and the volume of whatever somebody's looking at on the screen while they're training.
Interesting.
So if they're not moving their brain activity in the desired direction, then we withdraw the reward.
Okay.
And
the reward
and withdrawal is diminishing the brightness and the volume of whatever's on the screen by 75%.
Interesting. So the orienting reflex, I'll come back to the screen in a second, but the orienting reflex, you sort of outlined it before, that there could be different goals depending on the person, which makes sense.
Oh yeah. The protocol that we're developing that leans on and uses the orienting reflex as a, reward, no reward, as a reward premise. That's the mechanism is, whatever the quantitative EEG told us was needed. If somebody is not producing enough alpha, 8 to 12 hertz activity in the front of their brain, we'll then set up the protocol so that as long as they're heading in the direction of increasing 8 to 12 in the front of their brain, they get to watch whatever they're looking at on the screen with full brightness and volume. And then as soon as they go outside of the zone, the brightness and the volume just boom, drops. by 75%. As soon as they start doing what we want, the brightness and the volume comes back.
Interesting. So to take it back to the seagull example, there would be some people who are too reactive to the seagull and you're trying to sort of calm their reaction, if for lack of a better word. And then would it go in reverse where people are not reactive enough to the seagull and you're trying to stimulate that somehow?
Sure. So
do you get one more than the other?
I don't find any value in counting about that.
Interesting.
It's like, we've been doing this for 25 years. That's just not a metric I'm keeping track of. I think it probably has to do with the history of what somebody's lived through and what kind of complaints they're having about the way their life is going or they're functioning, that would go one direction or the other, more or less. But almost always there's some combination of both.
Interesting. So I'm thinking in regards to a student with ADHD, for example, or I know that you do work with Alzheimer's. My guess is that those would be opposite. And I guess that's not the case. That
not really.
The student with ADHD would be, my guess again, would be that the student with ADHD would be trying to, in your words from the last conversation, imitate something, the brainwave activity of a Tibetan monk, I think were your words, as opposed to an Alzheimer's patient probably would be, my guess would be going the opposite direction. Is that
well, that's it. Like, I don't know what the opposite of a Tibetan monk would be. Howard Stern.
Yeah.
I don't know, but it really is the diagnostic categories. I think this was a point that I tried to make last time. The diagnostic categories are not really that useful when we're talking about this level of intervention, because what we're doing is intervening at a very, very basic level that has to do with the efficiency of the central nervous system and its ability to respond to stimulation from the environment, both internal and external. So how efficiently, how adaptively somebody can gear their responses to what's happening in the moment is really more what this is about. So it's really all diagnostic categories that would show up in the DSM-5 are in some way describing an inefficient adaptation to normal life. And what we're doing with the neurofeedback is increasing the efficiency of the central nervous system itself. So ADHD, you tend to see people exerting more effort and putting more energy into the simple act of attending to what's happening in the moment. Whereas people with cognitive decline or traumatic brain injury or depression are having difficulty increasing their capacity to attend and respond effectively in the moment.
And you said earlier that either one of those people might be doing a combination
because different patterns of activity are occurring in different parts of the brain. So that's why just saying ADHD is an extreme generalization about anybody who's got attention difficulties, because what's actually causing their inability to focus their attention could be coming from 50 or 100 different things going on in their brain. So it really demands that we get more granular and specific about what's actually happening to that person's brain, and how are they organizing, how they relate to their current experience. Like what is it, what's going on in their brain, and how their brain is organized to deal with whatever's happening. That's going to show up in the brain mapping, and we'll then be able to see how efficiently or inefficiently they're bringing to bear all their neural resources. And then we develop the protocol to optimize and make, more efficient whatever their particular pattern is. So there isn't really a right or a wrong. It's more efficient or inefficient.
And part of that efficiency, last time we spoke, I was sort of wrestling with how conscious this was, and you were saying it's happening on an unconscious level. But
however, if we give you enough feedback, you may then start to develop a more acute sense of what it is that's going on in you that seems to be determining whether you're, getting to watch the movie more or not. You may become more and more aware of your internal state and how you can manage your internal state so that you can get a better score or, do better on the protocol.
And so progress in the therapeutic sense, limited to the actual room in which this is done, because I want to get to generalizability in a moment, but the therapeutic progress that you would actually be mapping would be sort of time in that zone.
That would be one, that could be one thing. But we would also be able to see the normalization of the specific areas and networks, pathways. We could see the ongoing normalization of those particular pathways over the sessions. Because we do have a normative database that we can compare to by age, gender, and left and right-handed.
Interesting. So is there a diagnostic at the beginning to sort of compare?
Yeah, that's what the quantitative EEG is.
Okay.
So we use that as a baseline, because a lot of people want to know, well, where am I at? And how do I know whether I've gotten anywhere? Well, here's where you're at. Now let's do the training program. And now here's where you're at 3 months later. Like going to the gym, It's the same as going to the gym with the blue card.
What's the blue card?
I'm doing this many reps at this much weight when I start. And, 6 weeks later, I'm doing this many reps with this much weight, and I look like this.
Interesting. So I'm imagining on day one, or day one of the actual treatment, excuse me, my screen might look sort of erratic. And
oh, I see what you mean. No,
my actual video screen. So it might be bright and then down and then bright and then down.
And we'll control how much of that is going on so that you're successful maybe around 80% of the time, no matter what.
So you're trying to you're slowing the feedback down to sort of give me that target that's a little bit more manageable. Interesting. So you're almost tweaking the zone of proximal development or something like that. Interesting.
Yeah, we're always moving. Yes, we're always systematically increasing the level of difficulty as you progress and do better.
So it's almost as if you're making my range much bigger at first.
Could be that what will get you the reward, like if you're not producing enough alpha in the front of your head, will then reward you for producing a 5% increase.
Interesting.
Or a 1% increase. Okay. Every, in 5 minutes, if you can increase your rate, 1%, you'll get a reward. You'll be rewarded. And then you'll have to increase it 5% to get a reward. then 6, then 7, then 10, then,
Sure. So
we're shaping, it's behavioral analysis, it's behavior therapy, and we're just shaping the reward structure.
Fascinating.
Yeah, it's behavioral conditioning, just like any other, good dog, sit, good dog, here's a treat.
Interesting. But it's happening on a
completely
unconscious
level
that starts to creep into the conscious level. Interesting.
It may not. If we were, this again is, we're talking about the neurofeedback. If we were talking about regular biofeedback, like skin temperature, right? You can actually be thinking about your hands getting warmer, and the more you concentrate on your hand getting warmer, you will succeed in your hand getting warmer.
And that's not happening. I've asked this question before, and I'm nervous to ask it again because I don't know if I totally understood. If I am the patient and I'm sitting there and I'm aiming for the reward, what am I actually doing to control that screen? Am I able to think anything or do anything, or am I leaning forward?
It may turn out that you will notice that certain patterns of thinking or certain patterns of respiration or certain patterns of physical tension are actually contributing to a better or worse score.
Interesting.
Just like some kids have figured out right off the bat that, can you still see me? Yeah. Some kids figured out right off the bat that if they hold their breath, they get a better score. And I go, that's interesting. So
how long are you going to do that for?
Well, yeah. What do you think of that strategy kind of over the long term? And they're like, oh, right. Yeah, I'd be dead. Yeah. So what do you think? And you're like, nah, okay, no.
And then what do? Do they start experimenting with their breath? Does that happen? Interesting.
Yeah.
So
they'll start paying attention. And all we're actually trying to do when I do that little, back and forth, is to encourage them to pay attention in an internalizing way to really develop what psychology refers to as internal locus of control. And that if I had to say what is the main purpose of all of this neurofeedback and behavioral conditioning and blah, blah, blah. If I had to say what's the one thing it's most important, it's developing internal locus of control.
And neurofeedback is just one way of doing that.
And to me, the most direct, non-pathologizing, and immediately comprehensible way.
Okay. When I was doing a little bit of research, poking around, I was interested in what the detractors were saying.
To neurofeedback?
Yes.
Okay.
I found that people find it very woo, and I mean, this is worth a book in and of itself. How people have an opinion, and they'll say, "Yeah, neurofeedback's a little wacky," and then if you ask them to say anything else, they can't say anything else.
Mm-hmm.
And right. I'm not necessarily going out asking a ton of people, but when I do talk to people who I think have heard about it, or I have reason to suspect they might have heard about it, I'm always surprised how quickly they put it at arm's distance. I don't really get any cite. They don't cite anything, and then it's like, yeah, it's a little woo woo. And I think,
well, Kevin, what percentage of people in the United States are participating in individual psychotherapy?
Percentage? I would guess less than 5%. Okay. Well, let me, I'll speed it up, but let me run down this thing. So I thought, I was thinking about our conversation and the heart rate thing and the breathing and how you can control way more than you thought.
Mm-hmm.
And then one of the most articulate detractors said something along the lines of what they understood that the research has suggested is that it's not generalizable. And I thought, meaning it, you could get really good at that game and then, not, it doesn't really equate to anything else. And I immediately thought of those sort of apps, those sort of brain training apps that get you really good at math or rounding up tips or whatever. And like, again, I heard the same thing about them. They get you really good at those games, and then it's not generalizable. You're not a better math student or something like that.
Right.
But then what I couldn't reconcile that with was, okay, I go to neurofeedback, I sit in a room, I do this operant conditioning exercise that essentially attempts to increase my locus of control. I go out into the world. The argument is that it's not generalizable. That exercise, though, sounds a lot to me like meditation. It's like, it seems like computer facilitated meditation. And yet all you see and all you hear is how generalizable meditation is.
Exactly. And the reason is because it's not engaging you in a particular task that only activates a particular neural circuit.
I'm sorry if I don't understand. What do you mean exactly?
The Sudoku or crossword puzzles have you focusing on and activating specific pathways and specific levels of activity in your brain. Neurofeedback and meditation are much more systemic and global activities that are involving your entire central nervous system in a very complete way. And so that said, the operant conditioning at the level that we're talking about, and the purpose being to enhance neural efficiency, means that we're aligning with the basic principle of conservation of energy, right? Second law of thermodynamics. So the system is becoming more efficient. Conservation of energy then becomes its own reinforcer for the improved, more efficient way of organizing brain activity. The pattern becomes self-reinforcing.
And you're saying that meditation and
exactly
neurofeedback
are ways in which you are creating a self-reinforcing structural change in your entire central nervous system, which is also why they've measured 10 to 12% increases in hippocampal volume, literal growth of hippocampal tissue from people doing 8 weeks of, insight or mindfulness meditation.
Are there similar results with neurofeedback? Because I
almost
Dan,
there's fMRI changes of changes in the nucleus accumbens in people with chronic pain, where they did 3 5-minute segments of fMRI guided neurofeedback, right? And their perception of chronic pain decreased by 50% after 3 5-minute trials of targeting exactly the nucleus accumbens, which was the pain center and so, it's,
interesting.
Yeah, it's not,
and yet
it's not woo-woo if you know how to read the research and know what the research means.
Well, it's amazing how resistant people don't seem to be to meditation now. And yet there's an efficiency to neurofeedback that almost looks like computer facilitated meditation to me. It almost seems, having meditated myself for 7 years now,
right,
there's you risk not only you risk an inefficiency, but you risk an attrition rate if you ask people to stay in that for that long. You
Yeah.
talk about only 3% of people do psychotherapy. I would imagine even less would be able to meditate for that long.
Well,
and
more and more people are meditating, partly because they're doing it in groups and they're doing it as part of a social experience, as part of a spiritual experience, as part of, it's part of a lifestyle. Whereas psychotherapy, it isn't as much of a lifestyle thing unless you live on the Upper West Side of Manhattan.
Interesting. But I always see neurofeedback as it seems rife for having the sort of fad that meditation is having, and I don't mean that in a pejorative. I think that people probably benefit from if the madness of crowds is being pointed at meditation, then great.
Yeah.
But I almost see that it would be really interesting. I'm surprised. You said at the very beginning of our conversations that this research has been going on for, I think you might have said 40 years.
More now.
And yet it doesn't seem to have made it into the mainstream yet.
How many states have approved neurofeedback as a reimbursable service through Medicaid?
How many? I don't know. Why is that?
That's a conversation for another time, because I have somebody I need to talk to now.
That's totally fine. Okay, I'm going to put these two videos together if you don't mind. Push it out there, and then I'd love to have a part 2. I was looking at that website that you put me on, and I'm going to talk to a neurofeedback researcher at the University of Pitt.
Good.
So I would love to have a part 2 at some point, but I'll definitely do some more research in the interim.
All right, Kevin.
And then, let's be in touch. I'm fascinated with how this overlaps with the reading I'm doing.
Well, and if St. Joe's ever wants to develop a program for enhancing cognitive and academic performance or athletic performance, let me know.
I'd be fascinated. Do you have any sort of like packaging that you put together for the Westfield School or anything like that?
Oh, no, but we can go back and forth about that.
Okay. I'd be really interested with piloting it with a couple of families and seeing what they'd be interested in.
Absolutely. We can do a Zoom with a couple of families that are interested, and I'll, put up a PowerPoint and go through it with them.
Awesome.
All right.
Dr. Berman, thank you so much.
You bet. Bye-bye.
Bye-bye.